First off, I wanted to ask you, how are your facilities doing amid this outbreak?
So far, so good. All of our skilled nursing facilities and assisted living communities here in Chautauqua County are COVID-free at this point in time. We have certainly tested some folks who exhibited certain signs and symptoms, but all of those tests have come back negative at this point in time.
Now, regionally, there's been a concern from nursing homes about residents contracting the virus. Those tests that you've mentioned, they've all come back negative. How many have you seen?
We've tested probably somewhere between 8 and 12 residents in our communities here locally. The fact that we've been essentially locked down now for about a month has really helped to prevent the infusion of the virus into our facilities, and all of our staff are wearing surgical masks throughout the day when they're caring for residents and walking the halls. So that helps to also keep any spread down inside the facility should it come in from one of our staff members.
Now, that concern, were the residents presenting symptoms of COVID-19? Is that why they were tested?
So we evaluate our residents, the skilled nursing facility residents, 3 times a day with temperature checks, and we're also now doing pulse ox checks as well in those folks, because that seems to be one of the indicators is a low oxygen content in their blood. And so they would have they would have either exhibited a fever or a low pulse ox, and that would have then put us into immediate precaution mode. And we would have been donning full protective, personal protective equipment at that point in time and performing the tests. Unfortunately, many of those tests took 4 to 7 days to get back, and so our staff were forced to wear the full PPE throughout that time. But again, thankfully, all those have come back negative, and we understand that UPMC Chautauqua now has a more rapid test, and we should be able to get results within 45 minutes to 4 or 5 hours. And as nursing home communities, we are at the top of the priority.
Now, the testing process, I know we talked a little before the show, is that administered through your facilities, or is it administered through, say, a resident's general primary care doctor that they would see?
So that varies, Justin. If it's a patient in our rehab and skilled nursing facilities, our medical director orders the test, and our nurses take the swabs, and that is sent off to Chautauqua UPMC. If it happens to be in one of our assisted living facilities, that has to be run through their medical provider, their primary care provider, because we are not technically the medical care provider in an assisted living facility. That goes beyond what DOH permits us to do.
Now, if someone did come back with COVID-19, what is that process look like?
Well, Justin, we have, that's of course the biggest concern of infusing, again, this virus into our facilities. And so we have taken precautions and already created an isolation unit at our Heritage Park facility that can take care of 8 residents. And that is a separate and distinct unit in the facility that is not adjacent to any other resident care locations. And the staff who would be caring for patients in that area would be dedicated staff and would not care for anybody else in the facility. That's whether the facility has an in-house developed case, or whether we'll be asked to admit somebody to offload patients from the hospital to help with capacity there, admit somebody that is a known COVID positive patient. They would be admitted to the area as well. We also have a similar space available at our Heritage Green facility. We have the supplies to build that unit right now. And so we're just waiting to see if there's demand before we physically construct the unit. It takes less than a day for us to put that together and be prepared to take those residents. Any other residents that we admit that don't exhibit signs of COVID-19 are still placed into an area of our facility that's a quarantine area, and those residents are watched very closely for 14 days to make sure they're not exhibiting any signs or symptoms, that they haven't brought it in unknowingly, unlike those that we know for sure are positive.
Now, is there a plan to contact family members of residents if, say, they're exhibiting symptoms and a test has been ordered? And then eventually, if that test does come back positive or negative, are they contacted, or is it something that that resident would have to do?
No, we absolutely, in the skilled nursing community, we are absolutely required to communicate with the appropriate healthcare family members, those who are permitted to have that information. We're required to communicate with them any change in condition, and certainly suspicion of COVID-19 would be one of those cases, and then we would notify them immediately upon results. Again, in the assisted living world, it's a little bit different. We have to then rely upon the family members to get back to us and let us know whether or not that test was positive. We did have a resident in our assisted living facility that was hospitalized and tested, but the test results came back negative. So we're, again, still very thankful that we've had no positive tests in any of our assisted living or skilled nursing facilities in Chautauqua County.
Now, is that a concern where if they were living in that assisted living and maybe that communication didn't take place, how do you sort of verify that everybody else, okay, a resident from assisted living went to the doctor, got tested for COVID? How does that work? Because it seems like if that communication, it's a slippery slope, I would imagine, legally, where if the family didn't want that communicated.
Well, they're required to communicate back to us as a result of the fact that it's a positive COVID test, because we would then be required to make sure that we're paying attention to what's going on in the facility and hopefully even be able to get others around that patient resident tested should they exhibit any signs or symptoms. So we just stay on top of it. If we know we have somebody that's been tested, we continue to communicate with family members to make sure that nothing falls through the cracks.
Right, and at the end of the day, it's about just keeping everybody safe for sure. And on that note, personal protective equipment, better known as PPE, has been in short supply nationally. I know we talked before a few weeks ago where you said you were having a good supply of it. How is that supply now?
We are still working well with Chautauqua County has been working with us to get the products we need, and I think the supplies are starting to open up a little bit more as more and more entrepreneurs are getting involved with the business. Our biggest concern right now is not our current status, but would be the status if we ended up with a large outbreak in one of our facilities, which again, we don't foresee at this point in time. You've heard of that happening in other communities, but with a lockdown now for over 4 weeks, the likelihood of having a large outbreak in a community here in Western New York, let alone one of our facilities, is much less likely because of the precautions that we've been taking. We would expect more likely to be a scenario where we would have to admit somebody who's already positive, or we have one person maybe that contracts it and we move them to that dedicated unit. And so you'd have fewer people using the personal protective equipment but staying on that unit. So it wouldn't have to be changed out as often. And so as long as that's the case, we should be okay. If we were to have, God forbid, one of those large outbreaks, we'd burn through some of the gallons and other things pretty quickly.
Now, you mentioned the county officials and some of those local entrepreneurs. In order to replenish your supply going forward, especially if it does become low, what's that process like? Is it something where Heritage would purchase the equipment, or is it where maybe a county or a government kind of steps in?
It's a combination, to be honest with you, Justin. We have a purchasing manager who is constantly out evaluating the marketplace and trying to make sure that we have what we need. But the New York State Department of Health has also tasked the local emergency management groups. So right here in Chautauqua County, our emergency management group has access to some supplies as well. And as they get them, they communicate with us and often send those our way. So it really is a combination of those two approaches.
Now, a few weeks ago, we had you on the program talking about the need for workers at your facility. Since then, have you had a good response from the community? And is there still a need for the various positions that were advertised?
We have had some response from the community, but we're pretty much always looking for good, compassionate caregivers, and now is certainly no exception. We can always take more folks. Again, one thing about working in the healthcare world, especially in long-term care, we're always open 24/7. I mean, hospitals even have some ebb and flow in regards to their capacity and demand, but nursing homes are quite often at capacity or close to capacity, and we're almost always in need of qualified staff. So that's the case right now. We have been impacted slightly by some folks who are actually interested in going out to New York City or some of the places that are offering large pays for a short period of time in order to come during this crisis. We're hoping that our staff stay committed to the residents that we've been caring for through the years and committed to our organization so that we can continue to provide the care that we need to in our facilities.
And even though the visitation is restricted, we've seen some of those amazing images coming from your facilities where residents, families, and friends are visiting them through windows. What is your thoughts on that process? I know we're rolling some of it now. I mean, it's really breathtaking to see the community still staying so strong during this.
Right. We are happy to try to do anything we can do to reconnect the families with those who are under our care, including window visits, telephonic visits, video visits. Window visits are a unique way for them to physically lay their eyes on their loved ones, and those are appropriate given the appropriate precautions. It should not be more than one family group at a time. We ask for not more than one visit per day for a resident per time so that everybody has an opportunity. And of course, we don't expect any large gatherings. There should be no large birthday party celebrations with a group of people gathering around the window, unless, of course, they're staying significantly far apart and practicing good social distancing. But we really encourage small visitations for windows, one household at a time. Bring your pets. That's always a wonderful thing. We've had the advantage to have some of our horses go down from our Homestead stables here in Gary to our Heritage Village facility and visit the residents through the windows. And so that's been a fun thing too. The residents really have really adapted quite well, and for the most part, and are accepting of the situation more than, in some cases, family members. I think it's more difficult for a family member to not be able to visit their loved ones. But I love those whiteboard notes that you see that are going out through our facilities where we're passing messages along to family members through those whiteboards, and just staff who are doing an incredible job day in and day out to provide care and to provide for the mental well-being of our residents as well. I cannot tell you how much I appreciate our staff going into the facility every day, putting their own needs aside and caring for those whom God has entrusted to our care at our facilities.
Yeah, and really that's it right there. Kudos to your staff and your leadership for trying to provide that positive light throughout this whole pandemic, because I know for everyone it seems like there's a lot of nerves going on right now, a lot of worries, and it's good to see those smiling faces. I mean, this might sound silly, but just preparing for this piece, looking at those pictures, I'm like scrolling through them all because it's so nice to see the smiling faces of it, because you would want to say, you know, if it was my grandmother in that position, you know, I would want them under that level of care. So David Smelter, the president and CEO of Heritage Ministries, joining us on the broadcast today. Sir, we thank you for your time and appreciate you being here.
Justin, thank you. Thank you for having me here, and stay safe.